Why does transitional cell carcinoma spread in the urinary tract? Imagine a tiny, abnormal growth starting in the lining of your urinary system, which includes your bladder, ureters, and the area where your kidneys connect. That's what happens with transitional cell carcinoma, also called urothelial carcinoma. This type of cancer begins in the cells that line the inside of your urinary tract, which are called transitional cells because they can stretch and change shape. When these cells become cancerous, they can do more than just stay in one spot. They have a knack for spreading within the urinary system, and understanding how they do this helps doctors plan better treatments. One reason for this spread is that transitional cell carcinoma is often multifocal. This means that multiple tumors can develop at the same time or over time in different parts of the urinary tract. This happens because cancer cells can break away from the original tumor and travel through the urine to other areas. The urine acts like a conveyor belt, carrying these cells to new locations where they can settle and grow into new tumors. This process is called seeding. It's like seeds being scattered by the wind, but in this case, the seeds are cancer cells moving with the urine. Another important factor is what scientists call field cancerization. This idea suggests that the entire lining of the urinary tract can be exposed to harmful substances or carcinogens, such as chemicals from smoking or certain industrial exposures. These carcinogens can cause genetic mutations across a wide area, making the whole lining more prone to developing cancer. So, instead of just one tumor, multiple areas can become affected over time, leading to the multifocal nature of transitional cell carcinoma. In addition to seeding and field cancerization, invasive tumors can grow deeper into the walls of the bladder or ureters. When they invade surrounding tissues, they can also spread to nearby lymph nodes, which are part of your immune system. From there, cancer cells can travel through the bloodstream or lymphatic system to distant parts of the body, such as the lungs, bones, or liver. This process is called metastasis and is a serious concern because it makes treatment more complex. Understanding how transitional cell carcinoma spreads is vital for early detection and effective management. Regular checkups, imaging tests, and monitoring are essential because this cancer has a high chance of recurring. For people with risk factors like smoking or exposure to certain chemicals, doctors may recommend more frequent surveillance. Recognizing the potential for spread within the urinary tract underscores the importance of addressing these risks and working closely with healthcare professionals to develop personalized treatment plans. In the context of kidney health, it's important to remember that cancers like transitional cell carcinoma can involve the renal pelvis, which is part of the kidney's drainage system. This highlights why comprehensive evaluation of the entire urinary tract is necessary when diagnosing and treating this disease. By understanding the mechanisms behind its spread, healthcare providers can better tailor interventions and improve outcomes, always emphasizing the importance of seeking personalized medical advice from qualified professionals.